Good evening, everyone. We are now going to begin this webinar. My name is Helen Taguri, and I'm the Manager of Patient Programs at Crohn's and Colitis Canada. I'm very pleased to have the opportunity to moderate today's webinar and to learn more from our guest speakers, Mary Louise Martin and Caroline Evans. I'd like to start by welcoming everyone to our second webinar in the Youth Education series. Today's education webinar is called Managing the Cost of Care, Budgeting with a Chronic Illness, and is hosted by Crohn's and Colitis Canada and made possible through a grant from AbbVie. Please note that a link to the recording of tonight's webinar will be emailed to you for future viewing. For those of you who are new to webinars, I'll quickly run through the logistics and how you can ask questions. Right now, all of the participants are automatically muted so that everyone can hear the presentation and we can capture this webinar recording without audio interference. If you would like to ask a question at any point during the webinar, you can type it into the chat box. Simply look to the right of your screen and you should see a questions field. Throughout the webinar at any time, enter your question there and we'll make note of it and we'll answer it during the Q&A portion of this webinar towards the end. If at any time you are experiencing technical difficulties, you can also type this into the chat box and we'll follow up with you directly. If you are having trouble hearing the speakers, it may be your computer's audio settings. Try calling in with the phone number provided using a mobile or landline. Great, we're ready to get started. First, I wanted to give a little bit of a background on Crohn's and Colitis Canada. Crohn's and Colitis Canada was established in 1974 by a group of concerned parents of children with Crohn's disease and ulcerative colitis. We are a national charity with more than 65,000 supporters and 80 volunteer groups and chapters across the country. Our mission is to find treatments and cures for Crohn's disease and ulcerative colitis and to improve the lives of children and adults affected by these diseases. We want the general public to be aware of these chronic diseases and the toll it takes on the nearly 250,000 Canadians living with Crohn's and colitis. Crohn's and Colitis Canada has funded over $88 million in research to date. That makes us one of the largest funders of Crohn's and colitis research in the world. Today's webinar is the second in our youth education series and is part of our education programs. Our other programs include the Gutsy Peer Support Program, an online peer-to-peer support forum, the Go Here Bathroom Access Program, and the AbbVie IBD Scholarship Program. Additionally, we provide educational resources that cover a variety of medical, social, and psychological topics related to Crohn's and colitis, including our brochures, our local education events, and webinars. If you would like more information about our programs, please visit our website at www.crohnsandcolitis.ca. Now I would like to introduce our first speaker, Mary Louise Martin. Mary Louise completed her nursing degree at the University of British Columbia. After graduating, she worked on the vascular and general surgery ward at Vancouver General Hospital for 3 years before returning to Calgary to complete her nurse practitioner training. Upon graduation, she worked remotely in Fort McMurray before joining the IBD team at the Foothills Medical Center this spring of 2015. Mary Louise, it's now over to you. Thank you so much.
Good evening, everyone. Thank you for joining us. Congratulations to everyone from what I understand of the webinar purpose, you are either coming to the end of your high school career or just starting to embark on your university education or your post-secondary studies, which is an exciting but nerve-wracking time. So congratulations. All right, so the objectives of my presentation are to define direct versus indirect costs of inflammatory bowel disease, because that is important to understand. To review the financial programs that are available for people living with Crohn's and colitis. Discuss options for covering the cost of ostomy supplies and other medical equipment. Paying for medications, and also tidbits of advice I either heard from other healthcare practitioners or received feedback from students. So direct versus indirect costs. Direct costs include the services provided by the Canadian public healthcare system. Here in Canada, we're very lucky to have a universal healthcare system, so our hospitalizations, diagnostic tests, and emergency department visits are all covered by our healthcare system. You'll notice that in the slide I have prescriptions bolded and italicized, and we'll get back to why that's important, but it is in theory classified as a direct cost, so therefore covered by the Canadian public healthcare system. Indirect costs include the value of economic output loss because of illness or premature death, loss of income related to illness, needing to attend appointments and take times off, or in case of some of our medications we use with inflammatory bowel disease, to attend appointments for infusions. It also refers to missed school, and that's not just missed days of that refers to missed days of school in terms of missed educational opportunities, but also if you're sick at school and all of a sudden you have to take more time off and you may have to repeat a course or go back and to upgrade. It also includes missing out on sports activity, other activities, your traveling costs, as well as parking at either your medical appointments or at your infusion centers. It also refers to caregiver costs, the cost of covering your ostomy supplies, nutritional products, and complementary and alternative medicine. So the indirect costs are things that we as a population are individually usually responsible for. So cost breakdown in Canada. In a study completed by Roche and companions back in 2012, they determined that approximately 233,000 Canadians were living with inflammatory bowel disease. The economic cost for this population was estimated to be $2.8 billion in total, with direct costs being estimated at $1.2 billion and indirect costs at $1.6 billion. That broke down to an average cost per patient with inflammatory bowel disease to be $12,000, which some of you may relate to and think, wow, that's a lot of money, and others may think, oh, that's, you know, based on the medications I'm taking or my disease history, that's actually not as much as I thought it would be. But that's on average, so that's referring to everyone, not taking into consideration different medications they're on. So what programs are available to help support people with Crohn's and colitis? Crohn's Colitis Canada very generously has an IBD scholarship available to post-secondary education students enrolled in post-secondary education, and it's 10 one-time scholarships of up to $5,000 available to students of any age living with Crohn's disease or ulcerative colitis who are enrolled in a Canadian post-secondary educational institute. So it's awarded to recipients who are living well with Crohn's disease and ulcerative colitis and who strive to attain an optimal level of wellness and inspires others to do the same. And as you can tell, I do have some spelling errors in these slides, so I apologize for that. For any of your future projects, make sure you pay more attention than I did on this slide, so I apologize. For the application, all applicants are required to submit an online application, proof of diagnosis, which will be completed by your healthcare provider, application consent form saying the person is allowed to complete the form on your behalf, 2 letters of personal recommendation, and a one-page essay of about 500 words. This particular award is sponsored by one of the drug companies, however, you do not need to be on that specific drug to apply for the scholarship. Other programs that are available, and these are not just limited to people with Crohn's and colitis, are scholarship, grants, and bursaries. So all 3 are types of financial assistance that you do not have to pay back if you are awarded them. Scholarships are usually based on merit. Grants and bursaries usually take in financial need into consideration. There are also other awards that are based on academic achievement, athletic skill, extracurricular involvement, or special abilities. Awards may be province or school specific, and every school has an extensive list provided on your school website. It's important to go through all of the lists of scholarships you can find, because you may find some that do pertain to chronic illness that would help you qualify for the award, or else boost you up in terms of where you stand on the list of suitable applicants. There's also databases available to search all those scholarships, and you can put your information into that, and it'll show you what awards you qualify for. One of the ones that came up was scholarshipcanada.com or yiconic.com. One thing that I did notice when looking at, I think it was scholarshipscanada.com, was they did comment that they are a reputable site. So that made me wonder if there are some websites out there that don't have the best legitimacy of scholarships application. So if you're ever completing a scholarship application and you think they shouldn't be asking for this information in your application, it may be worthwhile just Googling them to see if there's any feedback saying it might be a bit of a scam. There's also scholarships, yes, and bursaries. They're fantastic. But with the cost of education right now, it is hard to find enough awards to fund yourself as you go through school. So other options help fund your way through school or the Canada Student Loans Program, and they are interest-free loans while attending school, meaning they do not accrue interest and you do not have to pay anything for the loan or the borrowed money while you're attending class. Additionally, after finishing school, your loan may also qualify for interest-free assistance upon graduation, meaning you can get a couple of years where you're not paying interest on that loan. There's also a student line of credit option, and that is set up with a specific financial institution like TD, CIBC. Downside of that is you start paying interest as soon as you withdraw the money, and you do make interest payments while you're at school, meaning you need to put some money back on. The other downside of the student line of credit is you do not qualify for interest-free assistance afterwards, meaning you have to start paying it back right away as upon graduation, but it is a great way to help fund yourself to get through school if needed, and then they also usually come with a relatively low interest rate. You may have also heard about the disability tax credit that is available through Tax Canada when you file your taxes, and it's a non-refundable tax credit that helps people with disabilities reduce the amount of income tax they have to pay. You're eligible for credit if the form T2201 is approved by the Canada Revenue Agency, and that form will be completed by your medical practitioner if you ask them. And what they're asking their medical practitioner to do is to certify that you have a severe prolonged impairment, and in this application they must also describe the effects it has on your activities of daily living. If you are approved for this, you do not have to apply for it on a yearly basis. It will carry forward for an extended period of time. There are some agencies out there that will help you apply for this and help to try secure the tax refund or the tax credit. But I have heard that some of them do take a fairly significant cut or charge a significant fee. So if you are looking at those, having that form completed and looking to work with one of the companies that will help you secure the credit, just make sure you have, again, look at the reviews and make sure they're not set up to try and take more than it's worth getting back. With your taxes, there's also a medical expense tax claim that will allow you to claim the cost of your ostomy supplies as well as your prescriptions. If there are, obviously, as we know with Crohn's and colitis, it is a chronic illness and it can wax and wane, meaning at times, sometimes people are really, really sick and unable to work. Within Canada, each province has a program that's set up to financially support people when they're unable to work. In Alberta, two programs are Alberta Works and Alberta Income Assistance for Severely Handicapped. And they help set up funding that you may be able to pay your rent, set up to help with retraining. British Columbia also has an income support program. Nova Scotia has ESIA program, and Manitoba has EIA program. I didn't include every province's program specifically because a lot of them are just referred to as income support. But if you search or talk to someone within your GI clinic, they'd probably be able to refer you to the specific program within your province. As I just said, the programs will vary in terms of what they're offering, but a lot of them offer financial support when unable to work due to illness. They also are set up to help with job training or retraining, and they can provide financial assistance when looking for work but not earning, or working but not earning enough to cover basic needs. So for example, if you are working but due to your illness you are only able to work part-time, they may be able to help cover the rest of your costs or provide some funding to help with that. So just it's reassurance that once you finish school or your training, or if you're going straight into the workforce, if that question's lingering over your head, like this is great, what if I get sick? So you don't feel the stress that you have to work. There are programs out there. Right, so what are the options for paying for your ostomy medical equipment? Some of the private insurance plans have coverage, but it's important to know what your insurance plan is. When I was looking at this, I actually looked at my own insurance plan, and I do not have coverage for if I needed ostomy supplies, but I do have what's called a health spending account, and I must say it's not a huge amount, so it could potentially leave you with if fairly significant gap for covering the cost of your ostomy, so that's why it's important to know your plan. The other thing is some of these plans have specific limits. They'll only pay up to X amount, and after you exceed that, you're responsible for the cost. Some of the plans dictate you have to use a certain vendor to dispense. So if they're asking you to use a pharmacy that's over an hour away from you to pick up your supplies, that's really inconvenient. So being aware of it, but you're able to budget the time and to get there, but also make sure I can get to the dispensary next week to pick up my ostomy supplies, but I'm running out this week. Having a plan in place to bridge you. The other thing some of these plans do is they limit what brands or device they will use. There's also, if you don't have private insurance, there's also provincial programs. So I'm from Alberta, which is why Alberta is mentioned in all of these, but in Alberta, the program specifically is called Alberta Aids to Daily Living Benefits. In New Brunswick, it's called the New Brunswick Health Services Ostomy/Incontinence Program, and Ontario, they call it the Assisted Device Program. Again, all the provinces have a program in place, but the name does change. Within the provinces, the maximum amount reimbursed varies. So some provinces pay 100%, and there's a couple that only pay about 75%. These programs also may dictate, for the most part, what brands you may use and what vendors you can use. So if you're transitioning into adult care and you're looking at one of these programs to help cover the cost of ostomies, it may be beneficial to know what ostomy supply they will use so that you can try it out before you age out to make sure it works for you. These programs also have an exception program you can apply to see if they'll cover what you are using because the other one doesn't work, but that needs to be looked into. Also, buying these products online can save you money. All the various ostomy sites, products, there are a number of websites that ship and sell them for less than you'd be able to buy them in the store. All right, so paying for medications. In 2012, the cost of IBD medications was estimated at just over $520 million per year back in 2012. Interestingly, it's classified as a direct cost, meaning the Canadian public healthcare system will pay for it. And that is true while hospitalized medications are covered by the healthcare system, but in the community, medications are frequently up to the individual to arrange coverage either through insurance, looking at their province support plans, or out of pocket for 100% of the cost. So available programs, every province again has programs available to help cover the cost of medications. If you're enrolled with an income support program, they do have programs to cover the cost of medications, but they may substitute a generic if it's available to, if there are generics available to switch out. Ontario has a lovely plan that's becoming available starting January 1st, and is covering medications for anyone that's 24 years old or younger. We'll be able to get all their prescription medications for free. The coverage is automatic, so you won't be paying up front for the medication and then waiting to be reimbursed. It's go to the pharmacy with your prescription, you pick it up, do not encounter any costs. Right now, when I was looking at the drug formulary, they have 440 drugs that are covered through the program. And I do have a link there. If it was clicked on, it would take you to it, so you could search what drugs are available and if the drug you're on is covered. It does say question mark for regards to the biologic agents. So when you go to the drug formulary and you click on gastrointestinal indications, it lists a number of medications, but interestingly, I don't believe the biologics were listed there. So it looks like they're still working out whether or not they'll cover the biologic agents. You will find adalimumab or Humira, ustekinumab, or Stelara listed on the overall formulary, but it's not listed under GI. So I think right now they've sorted out coverage for some of the other biologic indications, but they are looking at the ones for GI. If your drug is not covered under this program, you again can appeal to the Exceptional Access Program to see if they will provide you with coverage, or if they can arrange another medication for you to be on. With most post-secondary schools, and I believe it is all of them, but I can't say that with 100% confidence, they do have an insurance plan associated with them. A lot of them are listed under My Student Plan, which is why it says that on the slide. With this program, you are automatically enrolled as soon as you start school, meaning if you looked at your tuition, you will see a cost there for insurance. All the plans have a yearly maximum, and the reimbursement rate seems to vary from 60 to 80% of the drug costs, which means you will be responsible for either the other 40 to 80% of the cost of the medication. Most of the plans seem to be that you pay up front and then you submit your bill and they'll send you the money back. This is just important to know because if you're budgeting $100 for food, you go to pick up your medications and you weren't aware that you have to pay $100 up front for your medications, you may be stressed about where your money for your food budget is while you wait for your reimbursement check to come. Some insurance companies are fantastic at getting your money to you within a few business days, and other ones take a little bit longer. With the My Student plan, at least, and a lot of when I was looking at the post-secondary plans, they do say they will substitute generic if one is available. Another option for covering medications is if you are enrolled as a full-time student until about the age of 21 or 25, depending on your parents' plan, you may still be covered under their drug coverage, meaning you will not have to go and take out any extra insurance. But depending on what your parents' plan is, you may still have a yearly maximum, and they may reimburse at less than 100% of the drug cost, meaning you'll be responsible for the difference. The provinces all individually have non-group benefits, meaning Alberta non-group Blue Cross, Pacific non-group, and their programs available for economic supplementary health benefits program that provides coverage for a variety of health-related services not covered by provincial health care. They do have a monthly premium, but subsidies are available depending on your economic need. For a lot of their medications, they do reimburse. I believe most of them are at least 80 to 100%. So that is an option for potential extended benefits. So when choosing an insurance plan, things that are important to look at: what are your monthly premiums? Is it $50 a month? That's a fairly significant cost, especially when you're on a fairly tight budget in school. But if your school insurance plan is paying only 80% of your medication and you're responsible for more than $50 a month with your drug costs, it may be worth looking at taking out an additional insurance to cover that, or else take a different insurance program and drop the school program. So it's also important to look at what percentage of your drugs are covered, what is the yearly maximum. If you're going to hit the maximum within 6 months of being on the insurance plan and the other 6 months you're responsible for costs, it's probably not the best program for you. Also important to know, does your insurance company pay the medication fee up front, or are you getting reimbursed? So again, you'll be able to budget while you wait for your reimbursement to come out. As I previously mentioned, is it cheaper to have two plans? So if you're on your parents' insurance and they cover 80%, and then non-group's an option to add on top of it to cover the other 20%, is that cheaper than paying the remaining drug costs? And then last point, should you opt out of one plan and pursue another? So if you're looking at your student plan, your insurance benefits that come with your student's student insurance, the cost of that may be significant enough that there's no point in following that plan because you're not getting a lot out of it, so maybe switching over to another one. Right, so once you've looked and decided on your insurance, how the best way to stretch your benefits and save yourself money. So options are filling your prescriptions at a pharmacy with a low dispensing fee. So Pacific Blue Cross has this great website where you can actually enter whereabouts you live, and it will bring up the medication you're on, and it will bring up the dispensing fee as well as the cost per pill. So the medication I used this on was Mezavant. So one of the Shoppers Drug Mart was charging $2 per pill, and their dispensing fee was $11.60. London Drugs was charging $1.82 for the same pill with a $10 dispensing fee. Costco is charging $1.77 with a $4.49 dispensing fee. So as you can see, Costco would be the cheapest option to fill your medication. This may help your insurance budget go further, and may also help with your own budget. Yes, I took all this information from the Pacific Blue Cross. website, but based on what I saw when looking at it, I think Costco may have a dispensing fee cheaper dispensing fee across the country, so maybe worth looking at. But regardless, this little graph just brings attention to the fact that you can pay less for a dispensing fee or a little bit less per pill. So it might be worthwhile shopping around to find your cheapest pharmacy. The other thing you can do if you're running into financial issues and paying for your medication, and it happens all the time to people of all ages, is ask your healthcare provider for samples or discount cards. So frequently, all the clinics have a large amount of samples that they will be able to help cover you while you sort out insurance, or if, say, you can afford your medication for 3 months out of the semester and you need help the last month, it may be an option to ask them if they have samples available. Additionally, a lot of the medication companies, drug companies have discount cards, so they'll pay the remaining 20% if you're only getting reimbursed at 80%, or they may pay for 1 week of your medication out of a month. But your healthcare provider will be able to tell you what they have in hand. A number of these medication programs have a compassionate program available to us as healthcare providers, so all you need to do is let us know running into problems covering this cost, because to us it's really important you stay on your medication if at all possible. So if you let us know, we may be able to apply for a compassionate program to keep you on treatment. In order to find out about the discounts and the samples and the compassionate program, it's important that you communicate your needs to your healthcare provider so we can assist you sooner rather than later, because we don't like to see anyone get sick, and we especially don't like to see anyone get sick because of financial limitations. Next we come to our Biologic patient support program. So our biologics are, as we all know, very expensive medications. But luckily all the programs have a patient support program available to help you navigate your insurance coverage and gain access to your medication as quickly as possible. If you're being transferred from a pediatric clinic to an adult care clinic on a biologic, your file will be transferred between coordinators. So they'll take care of your paperwork, move you over to the next person you're going to be set up with, and then they're very good at letting you know what additional paperwork you need, how your insurance information will transfer, and helping you access assistance if needed. One thing about this slide I'd like to stress is if you're on a biologic and you're transferring between pediatric and adult care, your coordinator will likely start contacting you directly. So it's important that you check your voicemail. I had a young 18-year-old just last month that missed his Remicade infusion because he showed up to the clinic and they didn't have the drug available. And the reason they didn't have the drug available is he never checked his voicemail to return a call regarding some issue with dispensing the drug to him. So yeah, stay in close contact with your coordinators. And if you're on a biologic and you're transferring from pediatric to adult care, do not be afraid to ask your coordinator if there's anything you need to do with the transfer. So now going into more of the specific patient support program, AdviCare is the patient support program for Humira, and each physician has a coordinator assigned to them who will help you access the drug. So if you're not on a biologic now and you're just looking at what your disease potentially could be or what drugs you may need, and you're starting to stress about the medication costs, because I meet a number of patients who come in and that's always on their mind. They get their scope reports, they find out they have worsening disease, and they just go into this panic and they get really stressed, which is very understandable about the cost of the program. So it's great that we have these coordinators to assign to help you access the drug. So what will happen is if the decision is made to start you on a biologic, your information gets passed along to a coordinator who works at the drug company. The coordinator will then contact you and ask you for insurance information and will determine whether or not you'll be covered for the medication. With AdviCare, if you're not covered, they'll help you obtain appropriate insurance coverage through non-group insurance plans if needed. They'll also be available to help set you up with co-pay, meaning if you can pay for, your insurance will pay X amount and there's financial limitation to getting the rest of it covered, they will help arrange coverage for that. It's also compassionate dosing, so if your insurance company 100% shoots you down, they aren't able to arrange coverage for you, they have a great program in place that will cover their drug 100% themselves. It's also bridging programs, so if you're someone needs to be started on a medication quickly and the insurance company hasn't come through yet or we haven't heard, AbbVie will go ahead and start you on the medication. So far in my practice and from talking to other people, outside of Alberta, financial limitations has not been a limitation getting patients access to Humira, which is fantastic. But again, it's really important that if you're being started on these medications, that you return your coordinator's phone calls and emails so you can get access to drug. BioAdvance is the patient support program for Remicade, Stelara, and Symphony, 3 of the other biologics. And as you can see, the slide is the exact same because they have a fantastic patient support program in place, and they will help you access drug. The other thing I should mention is if anything changes with your insurance while you're on any of these medications, just reach out to your coordinator and say, hey, I decided to take a year off from school. Now I don't have my student coverage, my student insurance I was paying for school. You know, my job, I graduated school, and my work insurance doesn't kick in for 3 months. Let them know this, and they will help you sort out coverage. And that goes for all the biologic groups, biologic support programs. The 2 other programs that are newer to the market are Your Advantage, and they're the patient support program for Entyvio. They also have a coordinator that's assigned to them that will help you access drug, and they also have financial support and bridging programs available. Inflectra is a biosimilar that recently was released to the market, and again, they have a program coordinator who will help you sort out drug coverage and access medication. And they have financial support available as well. So if you're worried that down the road you may need these drugs, remove the financial concern because there's programs in place to help everyone access medication. The most important part is that you communicate with people what your needs are. So my last little tidbits of advice through working with transition patients is if you're starting off at a new school, I always advise all my patients to speak with an advisor regarding their IB diagnosis and ask them if it needs to be documented. What this does is it makes the school aware that you have an illness, not that they're going to come asking what your health is every day, but it's documented that you have an illness. So if you should become unwell during exams, it's easier to sort out an extension on exams or projects. I must say for patients who have documented this, and then if they unfortunately became sick during a stress heavy workload time, it's much easier to sort out help them sort out extensions than it was for patients that it wasn't documented on. Other piece of advice, speak with the student accessibility services. Find out if there's a benefit to registering with them so you can write your tests in private rooms. I have a few patients who are on Remicade and they write their tests in a private room so they aren't surrounded by people with colds or flu-like symptoms because, as you all know, more people are more likely to get sick during finals or midterm time. The other thing is you can be right in a room where you have easy access to the washroom if you're experiencing increased symptoms. The other thing is nice if you're having to get up to go to the washroom and you register to student accessibility services, they may also give you a little bit longer to write the exam. For any paperwork you need for either registering with student accessibility services, for your tax credit, please ask, or scholarship, please ask your healthcare professionals well in advance. Sometimes it will take a little bit to get to an email or a phone call, and then a couple days to turn it around. So the more notice you give us, is better. My last piece of advice for being during your post-secondary studies is if you're thinking about changing or stopping your medications, I advise all my patients to wait till you finish school. If your medications are keeping you in remission, that's fantastic. I understand wanting to see what your disease will do without the medications. It's just let's wait till you're finished with what can be a stressful, enjoyable, but stressful few years of your life. So we're not adding increased stress. So if say you stopped your medications and you were unfortunately flare off of them, that you're looking to now treat your disease on top of that. So bring it up when you're finished. Mention to your care provider you may want to look at stopping or changing your medications, but just wait to do it wait until you actually finish school to do it. So conclusion, there are financial programs available. Sometimes you have to search for them, but they are available. There are programs to keep in place to help keep you on treatment, to keep you on medications and help you feeling well. It's important that throughout your university, just like any other stage of your life, that you communicate with your healthcare providers about any obstacles you are encountering, whether it's increased symptoms, access to medication, or needing support. Let us know. We are more than happy to help. So thank you.
Great. Thank you so much, Mary Louise. That was an excellent presentation. I'm now going to move on and introduce our second speaker for this evening. Her name is Carolyn Evans. Carolyn completed her Bachelor of Science from Acadia University in 2013. She is now completing her medical degree from Dalhousie University and is expected to graduate in 2018. She was diagnosed in 2007 with Crohn's disease, and Caroline is currently in remission. Caroline enjoys traveling, running, skiing, and yoga, and living by the ocean. She is also a 2016 recipient of the AbbVie IBD Scholarship. Caroline, it's over to you.
Great. Hello, everyone, and thank you for the lovely introduction. I really enjoyed Mary Louise's presentation, and I actually wrote on a to-do list that I need to send an email to my case advisor about an insurance plan, so we all have something to learn. All right, I'm just going to head on to the next slide here. If I can. Just having a little bit of a technical difficulty. I think it'll catch up. There, great. Okay, so my presentation is going to build on Mary Louise's presentation. So again, we're talking about managing the cost of care when you have IBD. As it was mentioned, I've had IBD for at least, well, it's a decade actually now. I am currently in remission, but I don't take that for granted. I'm on double therapy, and one of them is a biologic, so I know all about worrying and managing the cost of care, and I'm here to just sort of share my personal experiences, and there'll obviously be a question period after, so please feel free to ask me anything. So my first slide is just going to be about budgeting as a student. As you heard, I have an undergraduate degree, and I'm now doing a second degree in medical school, which is very expensive, and I find it really great stress management to have a budget, and it's really simple to budget. It just involves 3 steps. I've broken it down into. So the first one is you have to make a budget, and if you are yet to start any post-secondary education, this might seem a bit daunting. I know that even the cost of tuition might seem really high, but I promise that there's lots of resources out there. So at both my universities, I've met with the scholarship and financial aid departments, and they can help walk you through what 4 years of tuition is going to look like, what the living costs are in that community, extra costs on top. So don't feel that you're alone. You can always reach out. And actually, both my universities that I've been to have online calculators that just let you throw numbers in and play around, figure out what sort of budget might work for you and what yours might look like. And of course, the government of Canada has great student budget worksheets that are totally free online, and you can download them. The second part is sort of keeping yourself in check. I remember when I first went to university, I was very overwhelmed with how much money everything costs. It's your first time leaving your home, so you're buying, for most people, and so you're buying groceries and household items, things that you didn't really maybe think about before. And I would sort of print my bank statements and color code them. And you really just have to see where you spend your money, and it's sort of learn as you go. But if you can document what you're paying, there's apps for this. I'm sure most of you know more about them than I do. And the biggest thing is also paying on time. So ever since I moved out, I set reminders and alarms in my calendar about when certain things are due, because you don't ever want to be missing bills. And also, if you can set up pre-authorized payments and there's no penalties added on that, then that's a great thing to set up. It's all about stress management. As you all know, if you have IBD, and I obviously have it too, that stress is a big factor in how well I'm feeling, so I try to be as proactive as I possibly can. So for me, setting up reminders is what I like to do best. Oh, whoops, I jumped ahead there for a second. And then my third step that I included is just check in with yourself, because you can kind of get caught up in budgeting, and it's not about counting all your pennies all the time, but just really making a plan that works for you. So if you find that you're spending money in certain areas and you're not having enough money to go out with friends or do something social for you, or maybe just go to a yoga class or go home to visit your parents some weekend, you might need to adjust things, and that's fine. Don't think that the budget you set out with is what you have to keep forever. Just make sure that it's working for you. And then I just sort of wrote some things to consider down at the bottom of this slide. Obviously, every institution is going to have different tuition costs. Thinking about residence versus off campus. From a personal point of view, I was actually a resident assistant the whole time I went to university, because I got to live and eat for free that way on campus, and then I was just paying for my tuition. So you can always find little caveats like that at whatever school you're going to. Again, meal hall versus groceries. Many people with IBD, including myself, have certain food groups I can't eat, and it actually was more cost effective for me to go to meal hall, where I had lots of safe food options for me. So that's what I chose the whole time I went to university, because it was cheaper than buying foods that fit in my IBD diet. And just little things like textbooks and transportation. One thing I learned about textbooks while at school is usually your library always has textbooks for your class on reserve. And I got through this whole degree here without ever buying a textbook in medical school, because they're usually at libraries. Those are just little tidbits that I've learned along the way. So I guess the meat of the presentation is sort of medical costs, and I thought Mary Louise did an awesome job. I was taking notes, and when she mentioned about shopping around and comparing prices between pharmacies, again, it's about the money, but I also found that some pharmacies have point systems, so you can get reimbursed for the full cost of your medication in a points reward system, and then you can end up buying sort of groceries or household items on that. And so, why not make the best of a bad situation and get points? Again, Mary Louise mentioned dispensing fees. And I just throw refills in there because life gets really busy as a student, and you might sort of be running out of refills and trying to go into walk-in clinics, or paying more dispensing fees than you need. And so it's really great to just sort of start the school year proactively and say, okay, do I have enough refills until my next appointment with this specialist or family doctor, whoever does your medication, and just sort of save yourself, the $10, $20 there, or like the afternoon headache of being worried that you're running out of your pills or medications. As far as insurance, I guess I'll just sort of go for my story here. I am luckily still covered under both my parents' insurance plans because I am a full-time student, and I did that on purpose. Obviously, lots of my friends took time off either during university or after university, and for me, since I'm on a biological therapy, I've done the calculations. My medications cost about $30,000 a year. So for me, I just said, you know what, I'm going to school, I'm going to keep my full-time student status under my insurance plan, and kind of like Mary Louise suggested, stay well as long as I can while I have this great deal going on. And usually insurance plans are really understanding. You can give them a call, and I stay in touch with my coordinator. Her name's Fabia Fitzgerald, and she works for Humira, and I tell her everything about my insurance plans and, little things I'm worried about, and she's always right there, an email away. So really reach out to any sort of program like that you can. And then it's important that if you are covered by your parents, you can save yourself the $300 of the insurance, of the university insurance, and opt out of that. So it's really finding what's best for you and looking to save money where you can. And I promise it's usually only a couple emails or phone calls away, and you can find certain ways to save money. I have traveling down here because I definitely found as a student, being away from home, I didn't go to any universities where I grew up, that you have to juggle a lot of appointments. You might have specialists in different cities, and I think it's really important to choose a university or college or any sort of post-secondary education where there's an on-campus health clinic, because this saves you the headache of trying to find a family doctor in a new place or a specialist in a new place. And they can usually find same-day appointments. You can get to know them. They can get to know you. especially if you're immune compromised. They'll make sure that you get all your immunizations, and I just found they were my biggest support system when I was at post-secondary education. Also, I always make all my specialist appointments around holidays, and that way, so when you're home for Christmas or Easter or whatever sort of celebrations your family chooses to celebrate, you can just, you know, you don't have to think about it. You don't have to travel home randomly. You're already home, and that's just one tidbit of information. And then I guess for financial resources, just like Mary Louise mentioned, you're not alone, no matter what your financial background is. So again, I'd reiterate that government student loans should be probably your first go-to, because there's no interest while you're at school. You don't really have to think about it, and they're usually very generous with bursaries and grants. And again, that's money you don't have to pay back. Student loans you will pay back eventually, but free money is good where you can find it. Then there's always student loans and bursaries, lines of credits from banks, and scholarships. So like it was mentioned earlier, I was a recipient of the AbbVie scholarship back in 2016, and I was so pleased and excited about this. It's a $5,000 scholarship, so that's a lot of money. For some institutions, that can be your first and second semesters. For other places, it's one semester, but either way, it's a huge stress relief to have that money, and really exciting to get that recognition. And again, I always look for the places that I work. I always ask, are there any sort of bursaries or scholarships available? You'll be surprised even if your parents ask at their work. Sometimes people, even just asking, might think of a program that exists that, you know, it's not out there. And then finally, I guess the last slide for me is just balancing it all. So it's really about finding a budget and a routine that works for you. A saying I always say is there's a time for work and there's a time for play, but it's really, budgeting doesn't have to be austerity. It just has to be finding a way to make you feel the least amount of stress you can about money while you're going to school, and making sure that you're healthy. So one part of having IBD is we usually need our rest, right? Our bodies are always sort of fighting with themselves, and it's very exhausting. So I literally in my calendar schedule the time that I'm at work or school. I schedule the downtime I'm going to have, and I schedule my social time. And sometimes just sort of looking forward and seeing that you have that downtime, you know, in the evening or the next day, it really can just help you put everything in perspective, because post-secondary education is very stressful, and it's really about learning time management quickly. And then another thing that's really important is I did get sick while I was in my undergraduate degree. I missed a month of school for being hospitalized, and since that experience, think it's really important that everyone has sort of a safety plan, especially if your school is going to be away from your hometown or your parents or your family. So it's just about having that safe place, whether it's someone else in your family who lives in the town that you're going to, or a best friend's house, someone that you can rely on if you're going to get sick. Know foods that are safe for you to keep you in your best health, and really about having a support network. So although I was very nervous to tell my professors and teachers about my IBD once I was hospitalized, I really didn't have a choice, and no one gave me any trouble. I had midterms pushed, I had homework sent to me at the hospital, I had teachers calling me. Really, people will go out of their way if you sort of let them in, and you know, if you need an afternoon off because you have to sleep because you don't feel well, or you're going to miss school for an appointment. I really just think that at the end of the day that communication is really key, and you'll find that people are extremely receptive. I didn't even know about all of this sort of arrangements that you could get for exams, but now I know that through Mary Louise. I might have to take some of those up myself, but yeah, it's really just about knowing what's out there and making it work for you, and knowing that budgeting is possible and that there's lots of resources out there to help you along the way. Thanks for listening to my ramble.
Great, thank you so much, Caroline, and thank you again, Mary Louise, for your perspectives. Definitely, it sounds like the main point that you both got across was to be organized and communicate. So thank you for sharing your both your unique perspectives. We're now going to open the floor up to any questions. So if you have a question, just to remind you, put it into the question box on the right-hand side there, and we will be happy to answer it. The first question that we have, Mary Louise, is for you. Our question is Crohn's or colitis considered a permanent disability? They're just wondering about this in terms of some of the grants that are available.
So if you read, or if you're referring to the disability tax credit, if you read it, it's referred to a permanent disability, meaning a permanent illness. So Crohn's colitis is a permanent, unfortunately, chronic illness that we do not have a cure for yet. So based on that wording, you do qualify for consideration for the tax credit. As I mentioned, just be careful if you're looking at doing that. I think everyone should apply for it because you do qualify for it potentially. Be careful if you're going to go through an organization that will help you, tell you they'll help secure it. I have a couple patients who have gone through that. A couple of them have been successful and a couple of them haven't. I think they've all incurred costs though for using their service. But yes,
okay, good to know. Okay.
It's the chronicity part of your illness that qualifies you.
Okay, so ask ahead of time if there's any costs that you're going to be incurring yourself.
If you're working with an organization, if you're just doing it yourself, you will have I think I don't charge, like no one in our clinic charges for it, but some of the clinics will charge like a $30 fee or something to fill out the paperwork.
Okay, good. Good. So talk to your GI ahead of time. Okay.
Yeah.
We also had another question about, I know you talked about the role that you play as a GI nurse, but what about for individuals who their GI clinic doesn't have a nurse? Who should they talk to about helping to navigate the financial side of things?
That's a good question. Crohn's Colitis Canada is a great organization to help direct people as well in terms of other people who may be living in the same city to direct you for the financial side of things. If it's cost specific or related to medication, I mean the Biologics, I'll have the coordinators assigned to help them with it. But if you're on a specific medication and you're running into problems with that financial side of it, you could ask your GI. I mean, when we request it, so even as a nurse practitioner, I have prescribing rights, but if I'm trying to access compassionate drug for someone outside of the Biologics, the physician needs to request it themselves. So you can ask the physician directly if they're able to fill out the paperwork, because regardless of who requests it on your behalf, it still has to be signed by that physician, so you could ask them. I find some of the offices, if they don't have nurses, if they're a private office, their clerical staff are unbelievably knowledgeable and extremely supportive, and some of them do a great job of almost filling the role as well as a nurse does. So that's another option.
Okay, great. That's really helpful. Okay, and I had one last question for Caroline. Did you find that it was difficult to work in the summer to save money, or was this manageable for you?
I actually never had any flare-ups in the summer, so I managed to have jobs through the summer and save money. And I guess, like I mentioned before, I sort of found ways by working for my university to pay less tuition every year or get those fees covered, so that what I did save from my job in the summer covered the rest of my school. But I think that's a very fair question, especially if your disease is acting up right now and very active. You might have to consider just having part-time work and sort of doing some of this income assist that I've learned about through Mary Louise. So maybe that's something she could speak to more. Hard to say.
Did you find that it was difficult because you were living in a different city than where your family is, or did you stay in the city where your school is over the summer?
A couple of different summers I did different things. I mostly at the beginning moved home just for sort of the reduced stress of living with your family is a bit easier than being out on your own, and I didn't find that an issue for me personally. And it's easier obviously to find jobs where you have the most connections. So as I spent more time in the community, as I furthered my university education, then I got jobs in the community where my university was.
Great. And one last question for you. What did you find was the most unexpected expense when you started school?
Unexpected expense.
Was it how much you spent on groceries or toiletries?
Yeah, there's a lot of sort of household things that you don't think about that start to add up. But I guess for me, being immunosuppressed sort of on the medications that I'm on, I buy a lot of cleaning products and sort of get sick often, so I was spending a lot of money at the drugstore on sort of cold and flu sort of things, and that's why I chose one that has a point system, because I have a stocked pharmacy at my own house, and I use points to pay for all those things instead of out of my pocket.
Oh, great. That's great advice. So thank you so much. Okay, so we don't have any other questions, and I'm just conscious of the time. It is almost 8 o'clock, so I just wanted to take the time to once again thank you both for your expertise today. This was an incredibly informative webinar, and I also want to thank all of our participants for their questions. As we're drawing near to the end, I'd like to take this opportunity to let everyone know that we will be following up with you after the presentation, after the webinar, via email to get your feedback, and please feel free to provide any suggestions on topics you'd like to see for future webinars. And we will also be sending you a link to the recording of today's webinar so that you'll have that and you can go back and look at any of the slides if you'd like to. So this concludes tonight's webinar. I want to thank everyone for being with us today and for the great questions. I also want to thank our speakers, Mary Louise Martin and Carolyn Evans, for taking their time out of their very busy schedules to be with us tonight. And also I want to thank AbbVie for supporting this webinar and other educational webinars that we have as part of our youth education series. So thank you so much to everyone for joining us, and I hope we've helped answer some of your questions regarding managing the costs of your care. Have a good evening.